Hi, good day to you. This is Dr. Amihan, your humble servant in health in the northern part of Antique. I hope that you are in good health at the comfort of your home. Many of our patients are asking what you will do if you have attack or signs and symptoms of hypoglycemia. So meaning to say, if you are diabetic and taking insulin or anti-diabetic medications, you are prone to develop what we call hypoglycemia, or decrease of blood sugars due to the medications, or sometimes due to the activities, or sometimes due to fasting. So this is this is how to identify and treat hypoglycemia. First is, if you are taking anti-diabetic medications, as what I said a while ago, that you are prone to develop hypoglycemia, especially if you are considered as in the old age bracket. So it is quite dangerous. Also, for old persons to take anti-diabetic medications if they have diabetes because of hypoglycemia. So they are prone to develop fall and stroke. They are also prone to develop heart attacks because of the hypoglycemia, because your hypoglycemia will activate your epinephrine pathway or release that will increase your blood sugar and heart rate. And then if you have hypertension, then most probably it will result to an increase of your blood pressures, which will trigger stroke-like symptoms, or frank stroke for that matter. And it will also increase your heart rate and constriction of your blood vessels. Then if you have heart problems, especially if you have coronary artery disease, then you will develop heart attacks and chest pains, or what we call anginal attacks. So this is how to identify. Some persons will feel that they had blurring of visions, cold clammy sweats, or kapamalhas nga malamig, and sometimes they had dizziness or blurring of visions, and hunger pangs, or daw ginagutom, and sometimes they had tremors in their hands, and sometimes they had dizziness, as what I mentioned a while ago, and sometimes they had loss of consciousness. So it is very important to know the signs and symptoms in order to treat hypoglycemia. So if your patient is not having loss of is awake, but with symptoms of cold clammy skin, cold clammy perspiration, hunger pangs, tremors, dizziness, blurring of visions, and sometimes headache, you can give them candies or table sugars, or 1 tablespoon of sugars, until the hypoglycemia symptoms disappears. Or you can give them a half glass of soft drinks or fruit juices in order to elevate their blood sugars, but give them gradually until the signs and symptoms of hypoglycemia disappears. Okay, because if you over-treat them and give them too much of your sugars, your blood sugar will also increase to a very high level, which is also very dangerous to the cells in the body. So, for patients who suffered loss of consciousness or nalipong na, bring them to the nearest hospital in order a proper treatment for hypoglycemia can be immediately given or to the patient. So bring them to the emergency room or to the emergency department for prompt and quick treatment for severe hypoglycemia, okay, in patients with loss of consciousness. But as what I mentioned a while ago, in patients who are awake, give them something sweet to eat in order to increase their blood sugars. So remember the treatment for these very dangerous situations in patients, especially with diabetes, who are taking anti-diabetic medications such as your oral form anti-diabetic medications or your insulin injections. Okay, so this is Dr. Amihan, your humble servant in health, in another part of Antique, wishing you good luck and Godspeed. See you soon. Bye.